Okay, we're recording. Thank you. All right.
Stephanie saved the day.
Yes. So I'm putting my hand around her sacrum area and somewhere below the base of her neck, because that is where parasympathetic system is. Is that uncomfortable where my hand is here?
No, but that is the area that I have.
Okay, but it's not causing it right now. So even though I just have like the weight of my hand there, but that just gives me a sense of, are they breathing slowly? Are they breathing fast? Sometimes I will stay here for several minutes. Sometimes I get the sense that I just need to start working. So it just depends. Typically, you're going to hear me say things that I don't even know. So this is what I do. I work to either side of the sacrum first.
Because that's where the pain is, or just all the time?
On every client. And I'm basically feeling the gluteal muscles. That's what I'm doing.
Your pressure is like, looks like a 2 or something, or?
I'm really bad with that.
Okay.
there's not really any pressure.
Yeah.
Maybe
Okay.
like 0.5.
Yeah.
Oh, okay.
I'm moving her skin,
Yeah.
but really that's, I mean, like nothing. So if we say that 5 is, holy cow, I gotta crawl off the table, can't handle it. This is, yeah, maybe half of 1. She can feel it, but it's nothing. I mean, it's just nothing. This gives me the sense of where her pelvis is, where the gluteal muscles are, how they're feeling. Gluteus medius, which is the one right on the side, that is typically one that is, as Mike was saying, is not firing. Typically it's medius and then minimus right underneath that. So it's easy to deal with maximus, but I found that medius is the one that is usually the culprit. I did not ask her if she wanted a bolster, but you guys might be a little familiar with me in that, you know, I don't typically do that. Oh, I guess I need my oil. Sorry. Completely unprofessional. Okay. Probably change the angle of the camera. And you might want to pick it up because I mean I don't know what they're going to be able to really see. So maybe bring it over here and you can use that thing. Yeah. Because they can't even see that she has a leg at this.
Phantom massage. Right here, or is that too dead on?
Well, we'll see when you can unplug it. Sorry guys, we're trying.
She has a foot.
We'll see. So all I've done so far is uncover it. So I do show you guys this. This is something that I do. It partly makes sure that she's not helping, but it's also getting it to where I can hang the foot off the side of the table because that's how I like to work with it. I have a sheet and a blanket. So that's just what I'm working with today. I will tell you guys that I'm not used to working on a massage table that does not move. I would have this up a lot higher, but so I'm just putting the oil on. I just have a little bottle going here. So this is about the same pressure as what I was doing on around the sacrum. I'm putting a little on my forearms because that's where I'm going next. So I'm just going to go up and down. It's really just, I'm not really doing a whole lot there. So now I'm going at an angle to get the lateral portion of gastrocnemius. And then I'll do the medial portion. I guess I would say I'm doing the bony part down to the fleshy part of the forearm. And really all I'm doing is just getting it so that I can do this. I make sure that I don't have the foot on my shoulder, so I'm doing that. I don't want that. But I just do this little crossy thing.
How does that feel, Cameo?
Wow, it feels amazing.
It looks like it would feel.
Yeah, it does.
That
So
feels
I
great.
am pulling gastrocnemius off the bone, off the backside, but I'm doing it with the pressure of my forearms and not my hands. Sorry, I'm looking at the camera to see if it's. So now I'm going to do a little bit of focused work on, so I'm feeling the bone of her lower leg, and I'm just pushing the muscle off the bone. Then I'm going to go on the inside. She's helping a little. She wants to hold her leg there.
Sorry.
So now I'm doing the same thing on the other side of the bone. Even though we feel gastrocnemius, it's the muscle that's underneath it. So any way that I can get that muscle to be relaxed so that the one underneath it can breathe more soleus, that's my goal. So now I'm going to go up and do, what do you guys do? I'm going up to do the lateral portion of the hamstring, not the IT band, but I'm really focused on the edge of hamstring, and I'm just rolling it over. And I'm hitting the center part. So what would you say that pressure feels like, Camille? A lot, a little?
I mean, a lot, but it feels good. So I'm not like you said.
So I will tell you guys that if you do that right on the outside of the leg, it never feels good. That,
Yeah.
and that's always what massage therapists do to me when I'm getting a massage. And I'm like, now I just want to kick you. Don't do that there. It's just, they think
Not a
that's
good-
what they're supposed to do. So I'm just focused on the lateral edge.
So when you
Now-
do that sawing, it's kind of the same spot that hurts, but you're coming at it at a different angle that it doesn't hurt so much, or you're still away from that spot.
So
I haven't done legs and feet
yeah,
yet. So,
so hamstring ends, right, like if you could divide it, that's the back, this is the side. Don't do the side, just do the back.
okay.
But it's a different way. Now, I do have her knee bent up, so I'm actually, her hamstring is not exactly neutral, but based on what she was experiencing, I wanted to do it there first before I do it this way.
Mhm.
Her glutes are now fired because she's in adduction, so her leg is out. Her glutes are engaged, so I'm going to be aware of that. For the crowd, she said that feels great. So I'm focused on where the two heads of, sorry, I'm trying to think and form my words and feel at the same time. So where the split between the medial and lateral head of the hamstrings muscles are. And you can feel that. You can feel it on every person. So there's just like a place that, and that's where I start my slow, deep movement up. Do a little bit more. The reason why I like coconut oil is because as it goes into their skin, It absorbs in. It gives it like a little sticky feeling, and then you know it's time to add more. So I'm on a little bit of hamstring, but a little bit of the adductors. And I think of it as kneading bread, as my grandma taught me. Lift up, push down. I can do it alternating. I can do it together. I always think of hamstrings as it's not everything that's going on here. We have to make sure that we get the medial. We just have to be aware of where the leg is so that we're not exposing. But before I start to work with the glutes, I'm gonna try to put her leg back in the neutral system so I'm not firing these. So I'm gonna do the same thing. I'm gonna add a little bit of increased pressure. So on our forearm, we have the fleshy or the tattoo side, and then we have the bony side. I'm on the fleshy side, but I'm rolling up so that when I get up to her sit bones, I want to be on my bony side, not my elbow, but I'm on just the side portion of my bone so that I can press down. She said it feels good. I know you guys can hear that.
Julie, is part of having her leg off the table being able to access like the inner leg without getting in there?
Yes. And because I use my forearm more, it just makes it
So you're
easier.
not.
So right now I'm above her sit bone, and I'm not pressing in with this. I'm on my bone, my pinky side bone, my ulna. I'm pressing down into glute, but up towards her opposite shoulder to try to wrinkle gluteus maximus. Is this causing any pain or discomfort in your sacrum? If you weren't comfortable with using your forearm, you can use your fingers or your hand first to try to feel out where the bones are. But it's all like my lunge. I know you guys can't see my legs, but this is
Mike
no
is using
effort.
this on Monday.
Yeah, I try not to use my wrists
Yeah.
because over time it hurts. And I want to be able to hang out here, like, you know,
For
however long, you know.
Are you waiting for like a softening?
Yeah.
Or when do you know what are you?
So even before you said that, so I'm like slowly, so as it changes, I feel the difference in my ulna. So then I relax a little bit and then I press back in, but not like all the way out. It's not all the way, it's just a little bit. I will rotate also, just depends on how much, but I'm also careful that this is not doing it because I personally don't like that. So you guys know I don't like to do what I don't find comfortable. So I'm feeling to see where the posterior iliac crest is so that I know where to put my elbow. So it doesn't feel bad, right, Kenya? Seems like I'm doing something. I'm like, really, just tell me where your bone is because I just want to know where to put the next elbow. So it could be, so I'm using my opposite one because I force myself to always use opposite arm.
What do you mean opposite?
Like I don't want to always use this one.
Oh, since you were just using that one, you're switching it up. Okay.
Can you describe for the crowd what that feels like? Apparently no. She's gone into theta
She's got
brainwave.
massage
She's
mush.
got nothing. Yeah. So it's again, I'm pressing
Thumbs up.
down into gluteus maximus, and towards the sacrum, but
You're on
the
an
power is
angle.
not coming from, I mean, look, I am not engaged on my bicep at all. It's all coming from my core, from just my lunge. I mean, this has got nothing. So it's just like my body weight is pushing my ulna into her glute.
It smells good on my jacket too.
She said it feels good on her sacrum, which is where she's experiencing her, which we
You're doing that thing with cooking and it feels nice to, I don't know, people can try.
we pretty much proved that it's how she's holding her pelvis just by her doing what we did with that action. I did leave the leg uncovered because that's what I do. I come back and be like, there we go.
Fluff, fluff, fluff.
Fluff, fluff, yeah. If she was not comfortable with her foot being in this position, I might leave it hanging off the table. Just depends. I know that I've had people, which it makes sense to me, to like work one side of the body and then go to the other side and kind of do a whole flow of the massage. I can't stop helping. I can't always say that. It makes sense to me, but everybody is so different that I can't have a routine of what I do. I do say I will work with the legs first, especially in her case, because it's her hamstrings and her glutes. And you guys know my little routine of hamstrings, glutes, and pecs are what we need. So again, I'm just putting this on. I'm just kind of just getting a lay of the land. I should have brought different colored sheets so you could see like where the difference between the white and the white, but I didn't think of that.
Night class.
Yeah. So one thing that I did not do, but I sometimes will, but I'm not doing it on this client. So their hand is always going to be like right, I'm trying to look at the camera. So, their hand is right here. And sometimes when they're in the prone position, their hand gets in the way. So I'll try to, you might end up having to move the camera. So if their arms are long and they're going to be in my way when I'm working on the hamstring, I take it, I shake the shoulder out. I don't know. Yeah, they can't see that at all.
Do you want me to move it?
Yeah, just kind of turn it towards you. You can do the whole thing.
I can see it.
Oh, can you? Okay.
Can see? Okay.
So, and I hang the arm off, and then I will then sometimes work with the scapula in a little stretch. So I'll do this side that way. I didn't need to because her arm wasn't in the way. So, and
Is that comfortable for you, Camille?
if I forget, then when I go to do it, then I'll be bumping their hand. It's not a big deal. Sometimes people move it anyway. When I go get a massage, I always put my arm in that position because that's where I want it. So once I got her oil on, I kind of do this little side thing just to see the side, how deep the bone is before I bend the knee and do the other thing. So I'm using my ulna bone and I'm kind of doing a diagonal. I'm just trying to cut it off like that. And that's like my pre-move before I get here. Feels weird?
Not good.
This is from that right there. Ego right there. That hurts over the face.
So first she said it was weird, then she said that when I use my, the palms of my hands, it's almost too much. So this versus this, which one do you prefer? This or this? This? Forearm typically always feels better.
Is that commonly a sensitive area?
It depends.
And that's not the leg with the foot
What is
that
that?
cramped up. That was the right.
My husband, I can't go anywhere near that, or he has a fit that She's a delicate flower in general. Have to work on.
So now I'm working with the fibula and the tibia, just trying to pull gastrocnemius off of it. I am using my thumb. I don't know if you guys can see that. I did on the outside, and I'm using my fingers on the inside. I'm just pressing in and up. Just depends on how accessible the bone is.
That's a lot of oil.
It seems like it, but I'm also going to, it's going to remain for when I'm in supine. So your hamstrings feel completely different right to left, extremely different. That probably doesn't actually feel that good.
Are you holding your breath?
Yeah. I don't know how to describe that. They just are extremely different. Where the two heads of bicep femoris are here on her left leg, far more pronounced. And I could tell right away it was going to be uncomfortable just because. So, and she didn't have that on her other leg.
But the other side is where the pain was, right? Your back pain? Or was that in the
No, it's
middle?
pretty central. So all that's just saying is she uses one leg. She's more dominant on one leg than the other.
So you just use less pressure then on the side you're working on.
Or try to attack it differently. If pressing straight down on it is making her not necessarily crawl off the table, but like, I don't love that. I don't want her to experience that. So it's the game of how can I get that muscle to change without pressing down on it? What can I get around it? So from this angle with her foot in this position, I'm going to see how that feels. It might feel the same way. It might be different. Who knows? I might have to pull out a different move. I don't know. So it has far less tension on it. That I'll call it the bumpy area. So is this better when I'm working on it in this position?
Yeah. Much better.
So it could be that the glute on this side, having that in adduction or having that fired when I was working with hamstring, the glute was engaged, so it's pulling on hamstring more. Possible. Clearly, it's not from the position I have on the table. This is something that she's been dealing with. Is it causing the back tension? It's definitely got something to do with it. How is the pins and needles sensation on your back? Is it there? Not there?
Not good. No.
Okay. Maybe like that. So this is, I didn't do this on the other side, but we'll do it for the purpose of showing. So I'm holding her ankle kind of towards my elbow-ish, but I don't want to squeeze it. So it's just there. I'm going to bring her heel towards her sacrum or that angle, but my focus is actually going to be the lateral border of her scapula, that I want to hook my hand on that border. And it's going to be a movement that goes together. So as I'm increasing the pull or the pressure of her heel to our sacrum, I'm feeling if she's changing in her breathing under my left hand on her scapula. Doesn't, I mean, I'm stretching her quad, but Can you describe how that felt? It seems like it's like this whole big stretch, but I'm really seeing if me bending and engaging more hamstring, is that like, ooh, thing? Does it cause her tension, tightness? You can make it like push it even more and hold it and, you know, make it be like this lovely stretch, but we don't need to.
What was this doing?
I was feeling her breathing.
Oh,
So now I'm going into her sit bone area. I am doing it this time on top of the blanket because her hamstring is different on this side. This side, I was on top, but I was a little bit on skin. I'm not on her skin at all at this point because you need to press down a little bit more medial and then go to lateral. I didn't do this on the other side. I was just like straight down. Does that feel different? Good, bad?
good, good. So what does the sheet have to do with what you're doing differently?
No, I'm not touching her skin at all for this side because her hamstring, you need to move it differently. And I don't think I could grip enough what,
Well, there's, you know, those things you do.
up here.
Yeah. Oh, God, I'm sorry.
What's that?
Yeah, I don't know. My body, apparently weird.
No, if you feel the sensation, so tell me if you feel any pins and needles as I'm doing it.
Nope, not there.
And the pins and needles is the nerve, right?
Nerve sensation. So chapter 6, piriformis, one of the lateral rotators, is the big muscle that sits right on top of the sciatic notch, which is where the sciatic nerve comes out of our sacrum. But that, it hurt or it caused
Hurt.
pins and needles?
Caused-
Okay. So as I was describing piriformis, uh-oh. Sorry, Marta dropped out and was waiting in the waiting room. So now let's see if we can attack it differently so that we don't get that. How's that?
That feels good.
So, you know how we were talking about the wrist on the other side? Pins and needles there. Did it go away?
Yeah.
So going from top and bottom, or superior and inferior, both gives it.
Oh,
And right there,
sorry.
I'm trying to say, so I didn't mean to hurt you.
No problem. I can make it all the feet.
Yeah, that's-
Child takes it every day.
So as I'm pressing here, any discomfort? So pretty much what we're seeing on this side is it's not comfortable to work on her glute on this side at all. However, when we were on origin of hamstring, that was okay, correct?
Yeah.
So it doesn't matter. So I've tried her glute in lots of different ways, and I don't want to continue to spend more time on it, but also it's not going to make it feel any better.
Okay.
But hamstring is helping. Releasing hamstring will help the glute have less tension. And remember, this hamstring is the one that has an exaggerated amount of use to it. Oh, there's people talking, but it's not us. Okay, so I'm going to work on her back. So we probably will bring the camera to a different place. I'll let you guys figure that out.
Well, you just let me know. Right. run it this way, or we can come from the other side if there's glare.
Do you want me to shut this and see if it makes sense?
Yeah, maybe. Maybe. Is that view okay for you guys? Oh. Yeah. Okay.
Does that make a difference?
Yeah, I think it helped.
You want me
I
to
didn't see
yellow
what
it?
it-
Yeah, that one too, maybe. So I'm putting some oil on my fleshy part of my forearm. And I don't start by uncovering the back entirely, male or female. I do it the same way. So I'm really just, it's a different way to put on the oil. But it also feels good, I'm guessing. I try to do like the oil application in a different way. And then, sorry, I'm going to step right in front of the camera. Then I get to the other side and I do the same thing. But I'm going to start going down her back a little bit. So my goal is I want to get all of the oil on so then I can just do my work, hopefully, without adding any.
You know, if anyone tried to attack massage therapists, we have some strong hands and arms. We're just, what's wrong?
Karate chop them.
You'd think that, but it's really not.
Things I'm feeling that.
So I'm using my broad forearm versus my hand. So for a couple years, my focus was to try not to use my hands to change my brain.
Did it work?
Yeah. And because my wrist, I was doing exactly what I teach not to do. You're in the moment, you're adding more pressure. And I was like, okay, I gotta stop. So, but you have to change your brain so much to use your forearm and not use your hands, or save them, I should say.
You know, when I try brushing my teeth with my left hand instead of my right, it's like, oh my God, this
I
is
did
really
it.
hard.
All right, I have no idea what I'm going to do, so I can't tell you that. But I'm at least going to divide her back. I don't know what I'm going to pull out and do, but at least I'm going to divide it up into sections. So I want to make sure that I get the outside or the right side. I'm going to focus on the middle. Try not to get too close to the sacrum. Did that cause any discomfort?
A little bit.
Yeah. So
Is there any bruising on the area?
no.
I feel like there's bruising.
And I want to make sure I get the outside. Normally I have my table closer, so.
Julie, if you put a little pillow underneath her navel area, would that help put her in more of that posterior tilt that then she wouldn't have the discomfort maybe?
Well, she doesn't have it normally. It's when I'm getting close to the area and when
Oh,
I'm
okay,
working
okay.
on that glute, right?
Okay.
Correct?
Yeah.
But you're right. Putting a pillow, and it can be a little pillow or a big pillow, having them lay on it on their abdomen, that will mimic the tilt. And so it a lot of times is something that helps. So yeah, I'm not actually doing anything. I mean, it feels good. I'm not doing anything. I mean, I'm not like, I'm focusing on this, I'm focusing on that. I'm literally doing that section thing where I'm just doing, okay, I'm doing this side, doing the middle, and just, everybody loves, you know, like this area. I'm like, you know, I'm doing nothing. It feels really good.
Yeah.
The whole point is to have her nervous system relax. That's the conversation that we're having. I am going to work on the scapulas here in just a moment, but this is just like, don't, so relax. when I push down on her, she likes to hold it there. So, all right. So, and my whole purpose of doing that was to relax her nervous system. That's it. So I am going to put the arm up here. Yeah, you guys can see that. So I have my hand cradled under the front of her shoulder so that I control it. And I'm feeling for the medial border of her scapula. With my fingertips, I would say my pressure is maybe a 2 because I'm trying to feel her bone. That's it. And the slower I can do it is the better. I'm at the superior angle. We kind of did this that last week.
Yeah.
If the anatomy is right, I can put my ulna on that medial border. Sometimes I have to play with my bottom arm to move the scapula where I want it. Kind of more the seesawing on the lateral border.
Thank you, Cameo.
Put my, I need to keep that close to me. And I'm out of. So I've told you guys before that I work, whoopsie, I got it. I work the triceps when they're in the prone position. So that's what I'm doing here. The forearm, the same. And that can be a lot of different ways. So I did cause redness by that little bit that I did. So you know that I increased the blood flow to that area. It wasn't painful, was it? No. But I definitely palpated her bone and got down as deep as I could.
Yeah, I have self-harm scars on the bottom. I don't know if I'm supposed to do that.
Do you want me to move this or you good?
Yeah, 'cause, they can't even see her arms so I need this angle. What makes a
Very
good
well.
camera person?
I'm experienced.
Yep. So I have one arm underneath, just trying to get to the acromion or the AC joint so that I can manipulate the scapula if needed, which this side needs it. So this whole side.
I messed up. on
You just
this
use one
side,
side more than the other,
which is interesting because this is even my dominant side.
which means you're compensating.
Yeah.
When one side of our body is our dominant side and it gets fatigued after chronic use of that way, it has to pull from our other side. Got nowhere, I mean, your body just pulls from all directions. So that I'm doing this side a little different because I can feel the bone, but barely, because of the buildup of tension on the muscles.
So you don't want to use your forearm because you can't feel the bone.
I'm going
much?
to, but it's taking me more time. Sometimes you can go right in and you can just go right, but adding more pressure is only going to make the fascia even tighter here. So I'm trying to allow it to loosen first. You probably don't really notice much difference, Cameo. I mean,
Not really. I can tell that you're using a little bit more pressure, but if you're not, then wow.
Does it seem like right-handed people are tighter on the left side?
right, that typically, yes. And it all depends on what what they're doing in their lives too.
Especially like a mother, you're holding, I held my baby on my left hip and whatever, and
This side is just so significantly different.
always-
Yay.
So I know you guys can't, but I did, it's definitely a lot more blood flow to the area because you can see that, but doesn't mean that it was a good thing. Actually, I wasn't able to do what I thought I could do on that side because her muscle tension is not going to allow it. And it doesn't matter if I can't manipulate the bone to make the muscle any different. It doesn't matter if I spend an hour on it. It's not going to change.
Is that my fault? Is it my- I mean,
It's
obviously,
just how
it
your
is my
muscles
fault,
are.
but-
It's holding tension there for a reason. I got it to change a little because blood flow did change, but working it over and over and over again is going to it's going to make her actually sore because then her body is going to be like, oh, now I can move, and then it's going to be like, ugh!
Would
So
you go from a different direction?
I'm going to,
Okay.
but I try to do similar things, but so now I got to step. I'm going to see if I can do it from this angle. I'm going to try to do the rocket ship thing and see if that works. We'll see. Except I gotta. Oh yeah, that still works. If your arm falls, let it. What's that mean? Is it good or bad?
It's a good.
Is it painful?
It's a little painful, but it's okay.
So I don't actually want to increase. I don't want it to be painful. And even though we always be like, oh, it's fine. I know I need the pressure. No, it's only going to make it worse. So
So you're letting up a little bit?
yeah, and I'm just going to hold it. So I'm on the superior angle of the scapula, which is the insertion of levator. She's twitching or something a little bit, and I don't know if it's from moving her head or in response to how much pressure. So the difference between how I'm holding my forearm is like my thumb doing this on levator. It's just easier.
You have your other arm up to be out of the way of the camera.
Yeah.
It's comfortable.
Because I can't. I mean, normally I would be,
Okay.
but actually it helps keep my pecs open. So I actually do this quite often so that I'm not like,
Right.
and I don't like to breathe on people, even regardless of the mask. And even though she's face down, I don't like people breathing on me. So I try to turn my head away. So now I'm slightly on more of the medial border from the spine of the scapula up to the superior angle. I'm just hanging out. You can see my wrist I can see it in the camera. Woo! So I'm purposely turning it, rotating it. There was a release, so I added more pressure and she said it hurt. And why? And I'm a person that says, I don't want to cause pain. It's not doing any good.
Is there a way to work the superior border of the scapula with your forearm?
Yeah, just like this. So I'm bumping over the spine of the scapula. I'm lightening up pressure as I go over it.
So it's firmer above, and then
Yeah.
as you get to the
You
scapula,
see how
you
red?
light up.
And that was just from me holding. Now, how is the sensation in your sacrum after working with this area? Any different?
No, there's nothing to do. It's okay.
So adding more pressure made her flinch and made it worse. Although that could have been like something that she was complaining of. It's not, but I keep that in mind for every client. Why do I want to, I don't want to do that. I don't. Even though they could take it, it's not what we want. Tuck that under. So I worked a little bit on each outside. I worked a little bit on the scapula. I know I'm taking longer than I would have normally, obviously. I want to work a little bit on the lamina. So this is a fingertip little move, but I might have already gotten too far down towards the sacrum. I want to be aware of that. So I'm feeling the mound of muscles, the lamina group to the spine of the scapula. So sometimes I go sideways or like outside to inside,
I love that
just
right
playing
there.
in the groove. If I'm standing on one side and I do, it's different on this side, then I need to go to the other side and I do the same thing. You can also come down towards her glutes. And you can do, like, I'm feeling a bump and then I like make like little flowers, I call it. I don't know. Little circular motions. When I go over a spinous process, I do a little circle. Just feels different. It's just working with it differently. So next week we'll focus on like a whole bunch of things to do with that, but the more time we can spend on the spine, on the back, it is such a crowd pleaser and it does so much and it's so easy on us instead of like, you do this whole, you know, I mean, this fingertip work is like, it's excellent. So, but that's a little bit of chapter 4. And so we'll work on that. So one thing that we did last week is we were talking about where the scalenes are. So this is like a pre-work that I'm doing for when I roll her over. A lot of times if people are complaining of tension in their upper back or around their scapula, I'll show you guys what I do in the supine position, but I do tell them that I'm going to work on your back some, but when you roll around to your back, that's where the majority of my work is going to be on your scapula, so that they're not like, oh, it's not better, right? So that isn't her complaint, but so last week when we did this, I'm lifting up. I'm
pushing
rolling
towards her feet as well, or no?
I'm pulling up towards the ceiling. I'm rolling over her SCM and then so it's like a kneading. I'm kneading her SCM, but I'm including scalene. Sorry. Got a little carried away. I mean, when I'm talking, I'm not focusing on what I'm feeling. I mean, I'm feeling, but not like.
You're doing a lot of things at the same time.
Yeah. I'm not in my zone. Was there pins and needle sensation in your hand when I was just doing that?
No, I have a clip, sorry.
Okay.
Were
Because her
moving?
fingers were flinching, and so just checking to make sure. Which is interesting.
Oh, I thought you were just covering it up so you didn't have to look.
That's what I thought too. I was like, okay, cool.
So if clients have something that they do, that they don't know that they're doing it, but it's like the thing that they do, like, you know, they're sitting and they're tapping their foot or whatever. If they're doing that on the table, their brain is like, it's not where I want it to be. So even if I thought I was going to do more, I would be like, I need to get that shut off again because now it's active and like, I don't know, I need to do something. So, no, it works out perfect.
You're such a good client for our class.
Yeah.
I'm always apologizing though.
And you need to stop. Okay, so I'm moving the camera out of the way so you guys aren't going to see anything for a moment, but all she's going to do is roll over. So I'm holding on to and there's a towel there too. That's what I'm trying to make sure we
You
get.
want to pull this out?
Nope. So go ahead and roll over. Depending on your client, you might say if you want them to roll towards you or away from you. If you feel like they're gonna fall off. So I need you to scoot towards your feet because I'm gonna take this face cradle off. And I need to make sure that your head is fully on the table. Yes?
I think you're a little too high in your mask, everyone.
No
And
worries.
we were gonna get to that.
Oh.
And then I need you to make sure that you're on the center of the table so that you have equal space for your arms on either side of your body.
It's from Ace. I got it for $3.
Okay, so it doesn't
That's my
matter to
outfit.
me if they have their, actually starting down here, so it doesn't matter to me if they, what they do with their arms.
Are we recording this on two different phones?
Well, that's
Well,
her.
that's her personal.
This is my phone and then-
So as she was making sure that she had equal space on either side of her arms, and yes, I do try to do that. I try to always remember to ask the client that, because sometimes then they're like, they don't have room for one arm, the other arm has got like all the space. So, but as she is checking in with that, so I'm lifting up and doing a little Traeger thing, but that also tells me where she's at with her lower body. It's calming to the nervous system. Try to get her back into the zone from rolling over. So I'm doing this, and I know you guys can't see that, but so I am purposely shaking her body to show me whether or not it's moving equally, left side to right side, but I'm just moving her ankles back and forth, and then you can see how everything moves.
Is it? Everything's jiggling.
It's supposed to. That means you're not holding
You're
tension.
doing a good job, then, Tanya.
Yay.
I don't know where my oil is.
Oh, it's hiding behind you.
Oh, sorry, time out, couldn't find the oil. So I know I just worked the back and then I'm coming back to the legs. For some people, I know that that does not flow because they want to, like where they ended on the body, they want to come back to that same spot when you roll over. It's a good thought. I can't seem to do it that way because I need to end with the pecs and the neck. So I don't want to start there, but that's me. So this is just putting the oil on. I am going underneath the, I know you can't see it on the camera. Actually, we need to bring that
Want me
back
to bring-
here. I just realized all they're seeing is white sheet.
Two kittens fighting under a white sheet.
Yeah, so then they can see. Okay. So I know we mentioned like that's a lot of oil, but this way I only have to put on a little bit, hopefully. So I want to be underneath, and I recognize I am under the sheet. I'm just making sure. I would normally have her uncovered a little bit more, but due to the camera angle, I don't want to give you guys like a great shot there. So I am going underneath the sheet, but that is just for what's happening right now. I do not do it this way. I would have it draped more. I'm just trying to be very aware. So once I get the oil on, I slip my arm underneath the knee. Sure, I'm not showing anything. And my other hand is going to go under her foot. And I'm pushing in on the joint, and then I'm pushing the knee towards her elbow, pushing her knee towards her opposite shoulder, pushing knee up to this shoulder, then out to this elbow. You can also do it like as a clock, like, oh, I want to be at 9 o'clock, at 12 o'clock, whatever. Just have an intention to it. But I'm pushing in on the head of the femur so that I can, if she allows me, I want to lift it up and push it over so that her latissimus dorsi on this side is getting a stretch because it's attached to the back of our pelvis. And I'm not doing this on the lateral part of her leg. I'm going for the hamstrings. So I'm pushing up on the border of the muscles on her hamstring. So it's the end of vastus lateralis, and the beginning of the hamstrings, right where I'm going. So this position helps me with that. I'm going to take my, whatever hand this is, and I'm going to try to see if I can find where the greater trochanter is, depending on the client and what they're wearing. I'm just being aware of, I don't want to give them a weird shot here. But I'm going to put my hand underneath, my elbow is on my ASIS, and I'm going to kind of do this push up and then push on the bottom of the knee. So can you describe how that feels?
It feels good. I don't know.
So it's like a joint movement, but it's
Yeah.
really more for the hamstrings.
Can you do that on, like, say, like a really big person? Are you able to maneuver that, or?
Yeah, see, she really
Stop.
So what I did is then when the knee was from there, I take the, I didn't talk my way through that. I just did it. So she was here, and you know, I was doing this thing. Then I take the sheet with my hand as I bring the leg over. That helps everything
Oh.
stay. I've learned that over time. Want to do that?
Nice trick.
So now we're doing adductors. So I did hamstring, quad, we're going to get to in a moment. So it's just like a long kneading so that I can pull up. So I'm doing hamstring again, hamstring, hamstring, and then we do more hamstring.
I'm sorry, we talking about the hamstring.
I'm talking about the hamstring. Now I'm going to push down on the adductor. Ooh, you felt that one.
In a good way or a bad way?
So I do a little bit more kneading and then adductor. And then I do like this split thing. I don't know if you can see. So
You want me to move this way?
adductor. And then I have my other arm underneath. And guess what I'm working on?
Hamstrings.
And then you can swap. One way is going to feel really good. The other way, you're like, I mean, it's okay.
Ooh, that looks
So quads are getting it along with adductors.
good.
Are you pulling
hamstrings.
up on the underarm or just
Yeah.
okay,
So I'm like doing this
okay.
at the same time that I'm going back and forth, and like, so it's like a sandwich.
How does that feel on your shoulders? Is that hurting
Mine?
you at all?
No.
No.
Because imagine, otherwise I'm doing this,
Mhm.
which it's not wrong,
Isn't doing
but why
anything.
do it? Yeah. So where our adductors end is where we get to the two quad muscles, one right on top of the other. So now I want to focus on the quad itself, the two quads there, which can be either forearm. So she's still like in a frog leg position ish. We will work with the knee joint in just a moment. So now I'm going to go back to gastrocnemius. So I'm going to find the bone and I'm going to push gastrocnemius off the bone, just this medial head. Then I'm going to go underneath and do the same thing. I feel bone and I'm just sticking my fingers to pull gastrocnemius off the bone. Can you describe that, Amy?
So on this side is uncomfortable.
The top part?
Yeah, but on the bottom.
Gravity helps. So then I straighten the leg and I bring it off the table. Usually I can do this on every single client. Occasionally somebody's leg is like, but, and then I go here.
That really puts your body in alignment with your quads.
Mhm. And it just makes it easier. I mean, I'm all about ease. I can do that side thing again, like we did when she was prone. So I'm like doing, like dividing the leg into thirds with my forearm, cutting it up. Even though it feels like we can put a lot of pressure on the quads, it's actually kind of sensitive. So then And I know Mike always talks about, you want to make sure you go around the joint. So you can do this easily with your thumb, you can do your fingers, but it's like a really good angle for me. You can do more work with the gastrocnemius, the lower the calf if you need. Do a little tray, bring it back. And it's done.
Yay. Yay.
Any discomfort in your sacrum area right now?
No.
You like that?
How's the angle of the
Camera,
computer?
you want it to?
I'm touching hamstring. I'm touching hamstring.
Sorry, I'm not trying to fight you.
And you are. So because I'm pushing in on the head of her femur, and it's irritating to her for whatever reason. She's fighting it, doesn't like it. So then I try a couple more times because maybe it's just like, oh, I didn't know you were doing that. And maybe it goes.
Look at her face.
So I'm still pushing in. I'm just not going to do my typical elbow, shoulder, shoulder, elbow, but I'm still getting it. That helps with the tension in her glutes.
How do you feel, Kenya?
I feel great. I just had folks
That one was a weird one.
Oh, yeah, that was okay.
So again, going on the border of vastus lateralis down into the hamstrings. And yes, you can use your arm. Then I'm going to find greater trochanter, push up on the head, up on the knee, the back of the knee. Actually, hamstring move. That's not. Guess what we're working on?
$1 million question.
You can't do enough on the hamstrings. Literally, you cannot. And if you can get the hamstrings to loosen, glutes are going to be better. Her back is going to be better. Her breathing is going to be easier. Everything is going to be better. Hamstrings, glutes, pecs. Is that too much? It wasn't on purpose, but it works.
Oh, Linda's trying to get in. She got dropped.
There she is. This, yes, wow, so different than the other one. And I didn't notice it in the prone position, but it's the angle. Holy cow.
Isn't that her hip that was cramping up too?
Yeah,
Yes.
yeah, you're right.
Yeah, that whole neutral alignment one. So I tried to work that leg about the speed that I would normally. So it seemed faster because I was doing less talking, but it's the same thing. All right, so now we're going to I don't think we want to be on this side with the camera because I think
Hey, Linda, are you muted?
She said, "Hey,
What's
Linda,
that?
are you muted?" I think she's talking to Linda.
oh.
I was, I'm not now.
Tell me where I'm going.
Thank you. Well, here, let me
Oops,
put, oh, sorry. Let me put myself where I'm gonna be, and then that might help you know where you. Shoot, I think actually we need to be up there. Sorry, guys, you gotta resituate.
All right.
Okay, that might be pretty good right there. Good job.
Thanks. My backup career as a camera person.
Yeah. I normally do this before I sit down, but I was worried about the camera, so I apologize. Hearing my untucking skills. All right. So this is, I do this for sure if they're complaining of upper back tension, you know, my tension between my shoulder blades thing. And depending on how much neck work is depending on how much of this I will do.
Which, by the way, feels great. Feels amazing. I'm trying to do something comfortable.
So my goal is to get to the medial border of the scapula. And so I have one arm that's playing with the arm to lift it up, and the other one is just like trying to get under there. The sheets being not perfectly fitted, I need to get that out of the way and things like that. So that's helping.
Yep.
So all I'm doing is my fingers are resting on the medial border. I'm not putting any pressure.
that?
Yeah. Not even that much. They're more like that.
Okay. You're just hanging out there?
Well, now I'm starting to go to her spinous process, the lamina over the rhomboids, and I'm pulling a little bit on the medial border. And if you could see her eyes, they're glazing. At this point.
So you're going this way, not this way.
Yep, I'm going from the spine, like toward, my fingers are coming to me.
With both hands?
Yes. But my right hand is going to start to move down the medial border. My left hand is going to stay at the top near the superior angle. They're going to work together and then separately. You know, you can milk a cow, everything together, or you can do like one and then the other. Just working with basically the rhomboid area, the area between her spine and her scapula. Super easy because gravity is my friend.
And you can sit down for a little while.
Yep. Let your arm fall. You're holding it. Thank you.
Sorry, Julie. So when you said rhomboid, so are you going from the spine over to the medial border?
Yep.
Okay.
Just doing like that. But I go all up and down it. When I get done, I purposely want to try to put her either thumb facing up or her palm facing up, and I want it to stay there because that's my pre-work to get to the pecs. Normally I would roll her on the front of the head. Camera's in the
Take
way.
a trip around the room.
Yeah. So I'm sitting usually in a stool, and then I come up here and then I do like a little fluff thing as I'm coming around to this other side.
You
Obviously
want
that's-
this?
No fluffing.
No, it's fine. Yeah. Well, I mean, because I don't want to have to get up. I just kind of roll myself, you know, and make that happen. So I'm gonna do the same thing. It's just
She's mind fluffing. the
I don't
camera.
want to have to move the camera again. So I just put it on the arm that I need to get underneath. My other arm is going to play with the scapula and lift it up and manipulate through the wrinkles in the sheet and potentially a wrinkle in the body. So once I'm there, I usually put the arm up. So it's just a way to get under. And you don't have to hold it. Yep, let the arm fall if it does. Don't hold your arm. So I'm back on that medial border. My right hand is staying at the superior angle. My left fingers are going from spine to medial border. I'm working them a little bit together, a little bit opposite, whatever. I can actually get to the inferior angle on this scapula. I could not get it in my hand on the other one, but this one I can. So I'm pushing up on the lamina groove, and then I'm moving her forearm and her arm because it makes it seem like a lot deeper movement. Seem like it's really no different. And then the same thing when I'm done playing in there. I'm going to try to get the arm there.
Do people fight that at all? Being turned like that?
No, and it depends on the table and them. And if I notice that they're rolling it back over, I purposely roll it back. So I'm prepping the pecs. That's hard to say.
I used to be able to move my pecs up and down. That was fun.
Like Terry Crews?
Yeah, like I used to be a power lifter, so I actually built up a lot of upper body muscle.
Okay.
But I probably
Would you like to do it for the camera right now?
No.
not right now.
Good, relax.
Okay.
So I'm going from the center of her chest, feeling the clavicle out to her shoulder. I'm getting the clavicular origin of pec major,
You're just following
pressing
underneath her
down
clavicle?
and out, but I'm just basically tracing the clavicle. Now I'm going to roll onto the shoulder, or where the AC joint is. I'm going to switch hands because now my hand is going clavicle, AC, down. I have the spine of the scapula. I'm just pulling up and it's moving her head. Stop helping. I'm not doing anything. And now I'm going to hang out a little slower. So I'm above the spine of the scapula. Now I'm getting to levator and posterior scaling. It's rolling out under my finger. Can you describe how that feels?
You're very strong.
It's all my body weight.
It's
This
your
is,
body weight
this
back.
is where body weight comes into play. I'm pushing myself forward and then pulling myself back.
It's a little bit much on my neck, but it feels good. Feels like I'm being stretched.
It emulates that because of the push down and pull up. Now I'm really just comparing left to right, or left side feels a whole lot better.
Yay.
So the same, now you'll be able to see. So if her skin felt tacky or sticky, I would have to add more, but you got to be really careful. Too much, you won't be able to slide. It'll go
Slide
against
all
you.
over the place.
Yeah. So for this side, because I want to try not to have as much pressure, I'm going to stay above. On the other side, I was here. So when the closer I am to her center, it's going to give me a whole lot of push and pull because I just have room to like dive it out. If I go up here, I'm going to have less. which potentially then, because she said it was a lot of, it was a lot. So the closer I am to her shoulder, I have less push and pull, just less leverage. So I'm pushing down on clavicle, out to the AC, finding the spine of the scapula, and rolling over.
It does feel much better.
So that's the difference. Typically, I do it there because
We're not all bunch of babies.
no, but the hard part is we have to also look for the nonverbal cues. If her eyes like popped open, if her toes started to twitch. So here's the other angle. And it's all I'm doing. I
It's
mean,
feeling
look
too
at,
much.
look
for
at,
you,
I'm not even,
Danielle?
I'm not using my
Just your
arm.
weight. Yeah.
It's like I'm pushing myself in and I'm pulling myself up.
So you're using your torso to
No, it's all my
go back
upper
and
body
forth,
weight.
right?
And it's a lot, isn't it?
It's a lot.
So where you put
Or I should say
yourself,
your core. You're using your core to go back and forth.
When you went to say-
sorry, altering, the ball rolls away. I don't use a ball, I use a stool. So. All right, so last part.
Right.
Okay, so I worked with the upper pecs. Now I'm pushing down on the clavicle, going to the sternum.
You're above the clavicle or right on top?
I'm inferior to the clavicle or below it. I'm not going as far under the sheet as it appears. I know probably the angle looks like I'm sticking my hand all the way down. So I'm getting into the anterior triangle,
Oh, it's really soothing.
It is.
and I'm really just seeing how thick upper trapezius is. You can absolutely feel levator. I mean, because it's right there, very prominent because of the position of the arms.
So if I have to give you a massage after this, I don't know how well I'm gonna do.
So now I'm going to angle her forearms in, and they may or may not stay because I want to press down and out. And I'm hoping that her forearms, she's not like holding them there, but I need to get under. So I'm really just working with the shoulder joint here, pressing down, taking it out and lifting it up, and just whatever massage move I can make that happen. But that was my focus of that. I always like this for myself, but I want to make sure that I'm pulling down, out, and up on the joint.
When you're under, are you using your palms to push down or are you pushing up with your fingers?
In which move?
When you did,
So I
you
did
went out and
this.
then you went under, but I wasn't sure what
Oh,
you were. Or were you pushed?
Really, I guess it was the leverage of my forearm, just
Oh,
pulling up on the joint. Oh, the battery is running low. We need to plug it in. It should reach, and it goes right over here. Somewhere there's a thingy.
No, is it this one? Yeah,
There we go.
that's the right one.
Okay, sorry guys. Okay. So then the last part, I'm gonna go down to, I'm actually on the thoracic spinous process. And I'm playing in the right and left lamina groove on the upper thoracic. I'm now in the spinous process, just about to C7. I'm pretty close. And I'm in the lamina groove, or the side on the right and the left of the spinous process. You can see her head is turning a little bit. Her head likes to go to the right. So I want to over exaggerate pushing it to the left. because that's where her erector spinae muscles want to go. I'm pushing up on the vertebrae to get to the occiput, which is causing like this type of action. It's like I'm stretching her head, but I'm really not. I'm not pulling. I'm just working. So it's causing like a little head action.
Julie, which finger do you have on that?
I have these are all touching.
Oh, okay.
The pinky
Okay.
was just along for the ride. The thumb's not doing anything.
I love my head.
Because I don't usually massage the head. So now I'm doing what Mike will call like the bowling ball thing. So I'm putting my fingers on her superior nuchal line with my ring finger right at her external occipital protuberance, or her bump of knowledge. So let me take my fingers back out. So they're here, but my ring fingers are right at the bump of knowledge because they're going to slide right below it into the divot. And once I have my fingers in place, I need to relax my palms, because if I'm holding like this, she feels that tension. So I want my fingers to be in place. I'm going to relax my hands, my palm, relax my thumb, relax my pecs, relax my shoulder, but my fingers can still work.
I see your
Yeah.
arm flexing.
So I'm holding her head in the palm of my hands, but there's no tension in my palms. Super important. And can you feel that I just tensed? Yeah. So whatever I'm exhibiting out throughout my body, she will feel. So once I get to where I'm holding the occiput with my fingers, sorry, I'm trying to brace the ball so I don't move. Then I want to relax everything. And could you feel that difference?
Yeah.
So always be aware of the tension in your body. So now my left hand is pressing more into her nuchal line. And now my right fingers are. My ring fingers are now going to both press up right below or inferior to the bump of knowledge. That's what they like to call the reset button. So I want my ring fingers to press up in there. And then I'm going to go out towards the mastoid process with my index finger. So I have like technically 3 points: right mastoid, left mastoid, and the release button. Can you describe anything?
Just snoring.
It's like a great, when you have your fingers up in the bump of knowledge,
Mm-hmm.
and then you're just moving your ring fingers out, and then you like that the reset area or whatever.
Yeah.
Oh, that's so cool.
It's like a form of traction, but all I'm doing is the bony line marks. And even if you don't know what they are, you can just be like, I need this bump here, I need that bump there. And so now I'm going out to come down to the bottom part of the mastoid process. Does another little traction thing, but I'm not stretching more than what the bone allows. So it's not the muscles that I'm on the bone, so that I don't pull more than what her body allows. And I know we showed this last week, but I'm going to do it again because I don't know for sure if it got recorded or what we did. But so the SCM I'm curling underneath it. Her head is turning slightly, but I'm not making that happen. I mean, I am, but I'm not. But that's just defining the edge of the SCM so that I can go from the bottom to the top of it, or kind of roll over it. Remember, we played with that when she was in the prone position. Other side. Just
Making me
defining.
sleepy.
Yeah.
Defining
I
this,
know, I'm like
yeah.
in a trance. Massage trance.
Up towards the mastoid process. And just rolling like bottom to top, rolling over it. And down to the scalenes. I'm rolling from anterior to middle scalene. I'm pressing in enough so that I can define them, but I haven't got to the first rib yet because she thinks this is pressure, but it's really not. So I'm just kind of prepping her brain. And once I roll over middle scalene, now both hands are going to try to find the first rib. So they're pressing both in together, but one side is going to give before the other, and I don't know which one. As she breathes, it changes the tension in anterior and middle scalene, so I'm working with that as well. Her left anterior and middle scalene are far more, have a lot more tension in them than the right. There's more space on the right side than there is the left. But remember, she likes her head to go to the right. So my right hand is holding its space on anterior and middle scalene. My left, and I need to change my fingers, but my index finger is towards the first rib, and I don't want that. I want it to be my middle finger, but I got to ease it out and press it back in. So I'm working on that right now. And I might not be able to do what I want. Is that a lot? Okay. So she took a deep breath, and that was in response to my pressure. So now I've lightened my pressure, and I'm just holding it. Is that better? More doable. So I'm going to try to maintain that pressure with my left fingers on her left anterior and middle scalene. And I'm going to start to play with the right. And right away, her left loosened. Switched your brain. So I don't want to add too much pressure on the scalenes because she already talked about that. I have this funny angle on my forearms, but I can't change them. It's not how I want them to be. Normally, I want to be like this with my arms resting because it's just my fingers. But I have to have my fingers at this angle in order to get into her anterior triangle. Just is what it is. But I won't be holding here for long, so. And there's her first rib on the right side. Now I'm going to press a little bit more on the left side. Her brain likes to be engaged fully, so I'm adding a little game to it. No, it just makes
Distraction tactic.
Yep. Was that less intense when I played? So I was just basically playing right to left, so that it wasn't as intense. I have a feeling posterior scalene is not going to work well, but I'm going to try. So I'm just trying to define the superior edge of upper trapezius. I'm trying to roll my thumb over it, but I can tell it's already a lot of pressure because her breathing is short and choppy. Is that better? Less intense this way?
Yeah.
So as a first-time massage client, I'm not going to dig into posterior scalene or elevate levator to get to it. because she's not in the mindset for that right now. Partly because I'm talking through the whole thing. It's really hard to relax.
Well, I'm sure she's trying to pay attention too.
That too.
Right, and she's on camera.
You know, there's that. So I know you said you like your head massage. I typically, you guys know, I don't typically do face or head. That's my own thing. Oh, sorry, you just went to sit down. And so this is how I would end. Well, you guys, I know you can see a little bit. So I'd go back to the feet. I go back to the Traeger, just to kind of change out. Then I put my hands on the outside, the lateral malleoli, and I rotate, I do an internal rotation of the femur and the knee and all the way down to the ankle. And then I swap and do the other side. You can do them both together. Sometimes I do, sometimes I don't. And then I also roll it out. And then I do a little,
Your hands are really warm. It feels nice and like cold.
so it's a little psoas work that we're doing, but we're doing it through her legs. When we do medial or internal rotation of our femur, we're releasing psoas. We do it to the outside. Guess what muscles we're working?
Hammies.
So it's just a way, and then remember way back in the beginning, I did this full body shape. And so I always do that at the end too. It's partly a good way if they're zoned out, you're like, hello, right?
Get out.
So it's a way to like bring them back out of their, if they were in their thing.
Trancing out.
We fall asleep.
I'm sorry you guys had to sit through that whole thing, but my hair's sticking out of the side of my head and all kinds of stuff. How was that for you guys? I've never done a massage on camera before.
Really, that was great. I really enjoyed it. That was great.
And I know it was longer, obviously. I thought I was going to try to stick to a better timeline, but we got talking too much. But I am going to record tonight's class too. So we'll see. It's going to be a different body. It's going to be some of the same stuff. So it'll be completely different. I don't do a routine, but I will do, I'm sure, some of the same moves. Next week, if I don't know who wants to come in and do whatever, but I'm going to do just specific spine and focus more on the bones and the muscles from chapter 4, because that was a little part that we missed. So we'll work with that. If there is a particular area that you guys have a question about, let's say, you know, what are some things that I can do with the hamstrings? Right? What is it? Yeah, I can talk for 5 hours about just working on hamstrings. But so there's different ways to do different things. So like she had a lower back situation. If there's a particular one that you guys want to focus on in techniques, then we can do that easily. So if there is something, please jot it down, send me an email, and I'll make sure that we do that. And however we do it, it could be, so I have done this to several people. You know that thing that we did with her in the beginning where we had her take her pain away by doing the pelvic tilt? I will do this when I'm feeling really, I don't know, I guess weird. So I can have the client stretch themselves through little body movements while they're supine and while they're prone. So they're getting like a full body massage, and I never touch them. And if they're open to it, it's the most fantastic thing ever. They get done with that and they're like, I feel like a whole new person. So it's really, I really just do like neutral alignment, prone and supine, but I have them work it a little bit differently.
It's like an internal massage.
Yeah, it's a weird thing, and I don't know how I ever came up with it, but
That's something you could do like during a lockdown. You know, have
oh,
them-
I did think about that, and
It has to be somebody worked on before.
No, it
To
just
know
has to
their
have,
body, wouldn't
it
it?
has to be a person that is aware of their body, that they're not going to, that they have to be aware of the subtle sensations before you get to like, oh, I feel the stretch. So it's like little things. So it's really just like a fascia movement, but having them do it to their entire body. But sometimes there are people that you can do different things with. And I love that one because I'm just like, let's see what we can do, right? So, but if there is an area that you guys are working with or you want to see, or it's a place on yourself, that's always good. So, all right. Any questions, Linda?
Nope, nope, that was great.
I'd like to see you do a tie session. Maybe sometime we can do that.
Yeah, that'd be fun.
We need to do that.
Are amazing.
Yeah. Yeah. So please keep in mind if there is anything for next week. I can't remember what technique is on the agenda for Saturday, but it's something. I don't remember now.
We did friction, so maybe
Whatever. Yeah. They're out of the book, so I don't know. But
I think you doing a session is really good. Like maybe you got to do it every week. Every week.
And you know what? If I did it every week, you would see again some of the same stuff, but
For sure.
it would be
Different.
different. So
Yeah.
which is good. I mean, it's just putting more tools in your guys' massage bag that you're like, I don't know, what do I do with this? Yeah, and I feel something funky. It's too much. It's not enough. How do I position myself? I don't.
And even just like even you talking through things, I've always found just watching and listening to, it helps. Just the verbiage and the visual.
I will say it was a challenge for me to like form my words as I'm trying to connect with my hands and then not hurt her. So, so by the way, as you're laying on the table, is your low back hurting you at all? All right. So before you guys hang up, I would like you, Cameo, to roll to a side, and I don't care which side you roll to, but roll onto a side and stay under the blanket. So just do that and make yourself as comfortable as you can for that. I want you to count at least 3 breaths. And as you're counting your breaths, I want you to connect with the sensation at your sacrum and tell me what it feels like. So a little bit of discomfort, that is your body talking. So I need you to do your posterior tilt or tuck your tail under, like curl. Yep. What did that do? So what I would say to her is every time you feel that sensation, the first little inkling of it, do your posterior tilt and it will take it away. All you're doing is changing your hamstring. Stinking hamstrings. Your hamstrings, right? So I do want you to, that's a great exercise of every time it happens, don't ignore it and don't be like, oh, there it is again. Just be like, oh, pelvic tilt, done.
Julie, could she also be engaging pelvic floor maybe? And that helps.
It's possible. Because we don't know if it is from the birthing canal. Is it from scar tissue? Is it from a buildup of the scar tissue from just the 9 months grow? And maybe it'll go away, but you're not going to be able to even evaluate that until she's no longer picking up her child. So there's that. So, which eventually, another couple years, but you don't want to wait for that and to see. Probably when they do a CAT scan or an MRI, they're going to say that there's no structural damage, which doesn't mean it's not musculature. It just means, nothing is damaged. So, oh. Sorry, Mike, I saw you went out and now you're back in, but yeah. What how would you, Krista, how would you if you were able to have her work through her pelvic floor, how would you ask her to do something different other than that posterior tilt? Could you, what
Well,
words would you give her?
I would just have her gently pull in in her lower abdominals, just very, very, very gently. And then that would bring her into that posterior pelvic tilt.
The I had one client that I was trying to find like the right words, and I said, if you focus on the area below your belly button and you just engage that area just a little, that was enough. And then, so that could work also. So just right below the belly button, just pull that in, just tighten those muscles just a smidgen. So it might work. Does it work? Not as much, not as good. So she still needs more, but that's a good way to maybe to see if that would eventually lead to that. But Mike, what homework would you give Cameo as a client?
I would potentially give her, please correct me if this is like way off base, but I might also do some like light stretching. So like you mentioned that you're feeling like real difference between the two legs when you were massaging them. So it makes me think if she's got some tight hamstrings, some light stretching that she could do, you know, a few times a week, or, you know, a little bit every day might help.
Yeah, and I know you guys might not have seen it, but in the beginning when she was talking about where the pain was, and she was saying that, you know, she's bending over to pick up her daughter, I don't know if your knees were locked, but they were definitely straight, which they can be straight and soft, but they can also probably be more, I have a feeling you were bracing, which is why her hamstrings feel, because one part is going to be stronger than the other. So a little, you know, just even a little stretch of, you know, you can do a hamstring stretch seated, I mean, or, you know, whatever. So those would be good little things to give her. It is homework, but I always think of it as, I want you to be responsible for what you're doing with your body. And the more aware I can make you of it and give you this little homework to do, but then that also is giving us a little bit of, I don't know what the right word is, but when she comes back for her next massage and says, it's no better, then I could say, did you do your homework? Did you do those little stretches? Did you, every time you felt that sensation, did you do that? Well, you know, some whatever. And I'm like, okay, well, you know, I'm not a miracle worker. You're with yourself all the time. So it gives us that little bit of leeway. It's not that we're trying to push off that, you know, but we can't do something in an hour and then expect it to be like magic. It's gone.
What?
Yeah,
That's it.
I
I
know.
quit.
Yeah. So there's that. But yeah, so that's good.
You know, it's amazing how, and we're so used to the pain.
Yeah.
That, you know, you
Yeah.
find yourself back in it, and you're like, oh my God, I've been in this for a long time. I forgot I got to switch
Yeah.
position.
Yeah.
You know, and then it's just like over time.
Our bodies,
It's like
yeah,
programmed.
our bodies are so amazing that we can override everything. I mean, until we get to the point where we're like, ugh, I mean, like, I'm, you know, something, but we can acknowledge that the pain is there and be like, well, I just have to ignore it. I just have to keep going. And those little sensations is our body telling us everything. So usually if we can make people aware of that, then they'll slowly start to get better. This didn't happen overnight. I mean, but sometimes people do have a trauma and it does happen that way, but Most of the time, the chronic things are from how we're holding ourselves. So, Marta, that was the first time you have seen me do a whole lot. How, is that a little different than what you're used to seeing?
So I was in the class with you once, and
Oh, okay.
but then I regret I left, and now I cannot attend
It's
for another 2 weeks. So
it's okay.
I would
2
like
weeks
to
will
be
be
there.
over soon. Yes. Yeah.
I feel I need to finish some more tests and learn more about the muscles, so I can use this time
Yeah.
in quarantine for that.
Yep.
Catch up
That's right.
on the work and learn terminology.
Yeah. Yes. But yes, Nicole has a question. She's raising her hand.
Do we know when the September calendar is on?
Oh, look, you're pushing it.
I'm a planner.
Yeah.
I'm sorry.
I might work on it today. I know it's October or not October. August.
Your tongue.
Today the 20th?
19.
20, whatever. Yeah. 20.
Is
I
it?
know, only 10 more days and
Jeez.
August is gonna be, I know. As I was sitting outside, I was sitting outside last night, after dark, and we had a campfire, and it was
So nice
cool and lovely, and I thought, uh-oh, it's getting to be fall.
Yeah. You can tell like the angle of the sun is a little different too.
Yeah.
Everything is-
Yeah, but thank you guys. I appreciate it.
Thank you, Julie.
So we'll see you
Thank
guys.
you.
I'm gonna be
Julie.
recording this, but anyway,
Thanks.
bye.
Thank
Hey,
you.
Julie,
Bye, guys.
what massage oil do you use real quick?
Oh, it's actually is pure coconut oil. The bottle says sweet almond oil, but it's just because I like the size of the bottle. So it is just coconut oil. Just
Is
pure
it fractionated or just pure?
Yep.
Just
fractionated coconut
Okay.
oil. I buy it in a gallon jug and just
Where
fill
are you
my
buying
bottle.
from? That looks on Amazon.
I do buy it on Amazon now. I originally was buying it the Bone Vital from Massage Warehouse, but it's cheaper on Amazon. So
what's the brand name?
yeah, it's BON and then VITAL. I might not be saying it correctly. It's 2 words, but I like it. It's not the cheapest stuff. The jug, a gallon jug is, I don't know, $55 maybe. But I have tried other stuff. Yeah. I've tried other stuff and I don't think so. But it's just, now do you feel greasy? Yeah.
No.
Yeah. I rarely have anybody say that they feel greasy. So
Great. Thank you.
you're welcome.
$45.75 for 12.
Yeah, on Amazon. So, all right, guys, thank you. I appreciate it. I'm gonna look for my glasses so I can see what I'm doing here. But
Bye. Thanks.
all right, bye, guys.
Thank you. Bye.
Bye-bye.
Bye-bye.
Bye. All right. So if I do that.
Is it just